Hello everyone and welcome to this webinar today. I'm Francis Seeley from GlobalNet 21 and a local network called Enfield Climate Action Forum. And by the name of that, you can guess that we're going to talk about climate change, but we're going to talk about climate change and health, because the World Health Organization has said that the climate emergency is a health emergency. And so addressing that is really, really important. And we've got two people with us who are very equipped to talk about that. One is Zoe Garbett, and she's the Assistant Director Communities from the North London Central CCG. And we also got Tamsin Ellis, who is a practicing GP. So let's start, and welcome, and I'm really pleased you both joined us. And if I could start with you, Tamsin, could you tell us a little bit about yourself and your interest, very briefly, in climate change and sustainability?
Yeah, thanks for having us, Francis. So I'm a GP in Islington, and I started getting involved in sort of climate health in about 2019. And since then, I've taken a number of roles, essentially focusing on what you're saying, which is that I'm trying to put health at the centre of discussions around climate change and what I'm seeing in the patients right now and what will happen in the future, both here in the UK and across the world. So I'm the chair of Greener Practice London, and Greener Practice is a network of people working in primary care who want to share about what we can do both to change in our individual lives, our professional lives, and on a kind of wider level. And I started working with Zoe sort of earlier this year at a North Central London level, trying to look at how we might support practices to both do things within their practice to make them greener, and also to try and look at the clinical side of where the hotspots emissions are within the NHS and how we might address those as kind of the largest public sector service and a big emitter.
Okay, and Zoe, you are also active and have been active for a long time, haven't you, in climate change? You were involved in Hackney. How have you brought your passion for climate change in the job that you do in the CCG, and how does that sort of translate into action there?
Yeah, so I'm now Assistant Director of North Central London CCG, so that covers Barnet, Enfield, Haringey, Islington and Camden CCGs. And yeah, as Francis has said, I'm hugely passionate about the climate and ecological emergency and for everyone to be doing as much as possible to reduce their impacts. I've always been a champion of sustainability, and I think at work that was, before the NHS declared its position on kind of going net zero by 2040, and that was last year. I think it's been kind of hard to galvanise that kind of core of people to kind of really work on this agenda. There's lots of stuff that's been going on the ground, but I think over the last year there's been a lot more commitment to do things at kind of at scale and to dedicate some more kind of resource to it. So I kind of bring my passion to work, I think, by going into as many meetings as possible and championing this, getting it on lots of agendas, speaking to senior kind of decision makers to make sure that this is being considered at the same level as our other top considerations around kind of quality, safety and financial kind of stability. And I think it means that the work that we're doing is kind of really kind of passionately led and engaging. So we're kind of delivering a plan that's a lot broader and a lot more kind of transformational than just a plan that kind of meets the kind of requirements.
Okay, well, let's talk about the green plan later on, because I think that's really interesting in what you're doing around that. But Tamsin, you're also involved, aren't you, in what's called sustainable healthcare. What does sustainability in healthcare actually mean?
I think it's probably more the question is what doesn't it mean, because it covers lots of things. So I started working with the Centre for Sustainable Healthcare a few years ago and designed a course for primary care. So my interest is in primary care, but obviously this is across all healthcare, both community and in trusts in what we're working on in NHS England. So what they talk about in kind of how they talk about it is in principles of looking at prevention, looking at sort of making systems leaner, looking at empowering patients and looking at low carbon alternatives. So that's the kind of 4 pillars in the Centre for Sustainable Healthcare model. But I suppose in a maybe more simple way, in an easier way to look at it, is we're looking both on the side of, as clinicians in our workplace, in a similar way that anybody in their workplace would think, you know, do we have recycling? What's our energy provider? You know, could we get a heat pump? These things that you're thinking about at home, could you do that professionally as well? So that's in primary care, you might think about that. But in the trusts and in the green plans, it's, you know, it's on a much larger scale in these large hospitals. And then I think on the patient front, what I feel passionate about in terms of sustainable healthcare is lots of these things are good for patients and the planet, and the sort of emissions is a byproduct of better care. So in sustainable healthcare, a huge amount of work that we're doing is saying these are all good things that we're doing for our patients. So for example, putting more nature prescribing in place, having more access to green spaces, or looking at asthma care and inhalers. So maybe we'll come on to that in a bit more detail, but actually a huge part of looking at inhalers in terms of their carbon footprint is saying, let's get asthma control better, let's get people feeling better about what they're using and understanding their asthma, and therefore you'll reduce emissions as a byproduct rather than that being the main effect. So I think sustainable healthcare is really patient focused and holistic, and putting people at the forefront of what we're doing, and meaning that you're not just looking at financial costs. So another Centre for Sustainable Healthcare sort of idea, which was developed by Francis Mortimer, who's a clinician, is looking at the triple bottom line. So looking at not just financial consequences, but social and environmental ones. And I think in healthcare, we're in a really good position to do that, because that's what we're looking at all the time. You know, a patient doesn't come in and say, I've got a chest infection. They come in, they say, oh, my house is damp and I'm, you know, my dog's sick. And, you know, there's all these things that come into it, as well as the primary health driver. So I think it's looking at healthcare, but also people's well-being as part of sustainable healthcare, and that's certainly what I'm interested in.
So, I mean, in a way, you're looking at systematic things, big organisational things, but you're also looking at what GPs can do individually. And you've got this Green Practice London group going. How easy is it to get GPs involved in that? I mean, how successful is it, or is it an uphill struggle?
I think it depends what day you ask me, but I think similar to what Zoe is saying, I learned very quickly that you win people over with, you know, practicing what you preach and by displaying it in a narrative way. So I don't think we're going to win these overwhelmed GPs. You know, I work in general practice 3 days a week. It is so busy at the moment. It's really hard to keep on top of things. We're being asked to do more and more and more for less and less money, and so I fully understand that. So when we go and talk to groups, one of the first things we say is, you know, these are a meeting of crises, you know, general practice is in crisis and we've got the climate emergency. I think you can't win everyone over, but you can win people over with saying this is part of our core business. So I sometimes use really real life examples of things. So I think talking in stories, talking in patient narratives really helps win people over. And like you say, in terms of the network, that's exactly what it is. It's saying in Greener Practice London, we're trying to bring people together so that you can really share the energy of trying to create change. So we had a social recently, and there was a GP who's been trying to do an allotment for patients, and they've had this great experience and she can't get funding for it. And then we had a social prescriber there who's just managed to get funding for his, and you're bringing people together to say, you know, you're not alone, you're not the only green in the room, we all believe in this and we think it's part of what we should be doing. So a big part of what I've done this year in developing the group is working with the willing and really encouraging what people are already doing and saying you're doing it on top of a really hard job, and that it's completely voluntary. You know, you can come and go as much as you need to. We're trying to develop as much kind of collective shared resources as we can. And we're also working at all levels. So like you said, you know, I just come back from COP, and my big thing is that we need to work at a systems-based level, but we need people to do that. So we sign a lot of open letters. We, you know, we kind of try and galvanize as a community to do something that is really taking action. And I think that helps with my climate anxiety, is that I'm doing something which I can see a change, which in healthcare, you know, it's a slow moving ship. Lots of things don't change quickly. And I think if you get enough people with the energy, and there's a lot of emotions in this, as you've both described, you know, having something that makes you feel like you want to do something, that's what I think's helped develop the network. We've now got just under 160 people signed up over a year. So I think that's, you know, whether that means that we've got GPs, I don't know.
It's interesting that you say, you know, getting involved in action is good for your own well-being. And I think that's really, really important message for all of us. You also talked about the importance of networks, and you're in several networks and they are important. And Zoe, you are as well. I mean, you're doing some really, really interesting things in trying to develop networks between the National Health Service and civil society groups. How are you going about doing that?
Yeah, so I'm part of a newish team that's called the Communities team, and we're very focused on health inequalities. And a big part of that is, and a big part of the work that we do is all about talking to people and voluntary sector groups and listening to groups about what they need to support their health and well-being. So a lot of what we're doing is kind of trying to, allocate funding and shift funding towards voluntary sector groups so they can kind of, be kind of equal partners in delivery of healthcare, talk to residents about what they need, and kind of shift the way that we deliver services around what people are saying they want, because a lot of the time we deliver services around what commissioners or clinicians say, which is valid, but sometimes only half the picture if we're not asking people about kind of how they want to access services. So in the kind of sustainability world, I've kind of brought those kind of principles into the work of the Green Plan, and I've been working closely with yourself, Francis, and some of the other voluntary sector groups in North Central London and the networks around kind of the community groups working in this space to really kind of just bring in that expertise, like listen to local people about what they think is important, what they want from the health service, and kind of work together on this agenda. And a big part of that is the development of this Green Plan that we need to put in place by the end of March. Lots of stuff going on around that anyway, but I really, we're starting to develop that kind of scrutiny so that the local NHS plan is put to people and voluntary sector groups so they can say where we should be going further, what they think might be difficult, because this is going to require, it's also a plan for everybody, isn't it? It's going to require change in the way that we deliver services or the way that things are done. So we need to start.
You're really innovative in that. I mean, putting a green plan to civil society groups and asking them to shout about it is, quite an adventurous thing to do. I mean, many organizations wouldn't do that. I mean, how are you going to do it? Is it going to be a sort of one-way flow, or are you going to encourage a two-way flow on this?
Yeah, absolutely, two-way flow. I think, from being involved in voluntary sector groups similar to those in North Central London, personally where I live, I just know of, the expertise that voluntary sector groups and residents can bring. So it's definitely that two-way conversation. I think, it's difficult in these times where we're all online that we can't just get in a room and maybe throw some ideas around. But I've started off visiting groups, hearing about what's important to local groups. So I came to the network in Enfield this week and heard a lot about the incinerator and greening, and just the people's experiences of the inequalities of the impacts of air pollution. So and then how I'm listening to that and kind of championing that within our organisation and putting those as priorities within the plan. But then when we've got more kind of pen to paper type a plan, it will go out to groups to kind of critique. And then going forward, we'll make sure that we've set up scrutiny of our targets. The voluntary sector groups are part of our programme board as kind of equal participants. And all of that will be very transparent. So it will be an ongoing, two-way conversation.
Okay, I mean, we've been talking then about what we're doing, and that's great, but we haven't really dealt with the main point, which is there is a link between climate change and health, particularly public health. Maybe we should address that as well, Tamsin. What is the link? Why is climate change going to have an impact on health?
Yeah, absolutely. So I think it's things that you might not necessarily think about. So I kind of think about it in terms of the main health consequences of a changing climate. So you've got a big one, which is air pollution, and anybody who's living in London right now will know that that's high on the agenda of the mayor and other people in London. So that has an impact directly on things like asthma, COPD, respiratory conditions, but also in the long term, it increases risks of things like heart attacks, strokes, even dementia. And we know that it's prematurely killing millions of people globally and 36,000 people per year in the UK. You've also got direct impacts of heat. So in primary care, we often talk about cradle to grave care. And I definitely think the most sort of vulnerable groups that I see are the young and the old, and the ones that are kind of, we see a bit more generally. So they might be impacted directly by heat related illness. So in 2020, 2,000 people died of heat related illness in UK. And then there's the kind of changing way that we see infection and things with the rising climate. So vector-borne diseases will start to go on the rise, and we might see more pandemics in the future. And then we have direct sort of weather event things that might affect health. So, you know, people might have been affected by that recent storm that was in the papers, the fact that people have, you know, power outages, or that they might have flooding. And, you know, we saw it in London this year with things like Whipps Cross Hospital was flooded. So directly on the services we are providing in the NHS and on people's wellbeing. And then again, a thing that I feel really passionate about and ties it in for me is the social consequences of this. So both on, again, huge global issues, and it's happening right now, particularly in the global south, but there will be migration of people, and there will also be, you know, the people who are being impacted hardest are often the kind of most vulnerable groups and the most unheard. You know, it's very, you're talking about kind of Zoe coming and being on consultation, is that often these decisions, these top-down decisions are made without hearing the people who have a voice, and often those people are working incredibly hard and being impacted by things they have no control over. So I think there's a huge amount of social inequality here. We know that things like domestic violence go up in hotter weather, that insecure housing becomes more problematic with a changing climate. So there's huge amounts of social consequences of a changing climate, and that is what we see in primary care all the time. So there's a lot of things there that can happen to do with health, and the big thing is that the positive thing is the solutions will be positive for health. So, you know, you make air quality better, that gets people cycling and being active and all these things that are co-beneficial for health.
Okay, I mean, it's quite interesting that, and two things sort of come out of that for me. I mean, when I attended the board meeting that you set up, Zoe, it was really interesting because I thought in terms of mitigation, you were doing a lot of things in the health service that were very encouraging, but what was missing for me was adaptability. How do you adapt to the climate change that's already happening? Carbon dioxide is already in the air. We're going to see an increase, whatever, between 1.5 and 2.4 at least, and that's going to have some of the consequences that Tamsin talked about. I mean, how important is it for us to, in a way, shift our focus a bit to adaptability? As the IPCC has said, we're not doing that enough.
No, I think that's a really good point. The NHS, the Greener NHS plan does call for consideration around adaptation. It's not something we've kind of challenged ourselves to think about as North Central London Programme Board. I know that individually, I can speak for kind of the trusts. I know that some of the trusts have made some plans around this, but it absolutely is something we need to kind of focus more on and do more on. I don't know if there's something from primary care, Tamsin, but from my perspective, it's just something that we haven't, we need to kind of do more on, I think.
I mean, Tamsin, do you want to respond on that? What's happening in primary care in terms of sustainable healthcare? I mean, are you looking at adaptation as well as what you can do to mitigate?
So I think there's something really interesting about asking the question. And I think through doing this work, again, my agenda of what I want to do, like you go into practice and the first thing people ask you about is recycling, when actually you might want to ask, hey, what are you going to do if your practice is flooded, which will be a much bigger problem than if you can't get a recycling bin in. So I think the issue with primary care is that we are very much listening first and seeing what their priorities are, as well as trying to do an education point around saying, you know, have you really thought about if this happens, what you will do? And I think, unfortunately, what we're seeing is that, you know, in terms of mitigation and adaptation, that extreme events will continue to happen and people will have to be forced to ask that question. So I think the practices that have been flooded over the years, I think the places that are being impacted are the ones that are saying, what are we going to do next year and how are we going to adapt to that? So I think particularly in primary care, we asked a question in our survey that we sent out across North Central London. And I remember questioning Zoe and saying, why are we putting that on the survey? No one's going to be bothered about that. And it was actually a public health person, I think, who'd asked you, Zoe. So I think it's often, you need the people who've got the, you know, I'm not a climate expert, I don't write the scientific papers, but those people need to be feeding into policy making on the ground to say, what are the right questions to ask? And what do we need to be asking to future-proof what we're doing in terms of preventing the emissions, but also that this is coming and we need to be able to adapt to that. And in healthcare, that will have huge consequences. You know, Whipps Cross, I don't know if you saw the images of people being transferred and the sort of, you know, things falling in, but that's not what you want when you're taking your loved one to hospital. And I think whenever you put the patient focus on the journey through whatever happens, it means that you really get a sense of what needs to change. So I think the questions are important.
The other issue that you raised, Tamsin, quite rightly, is the area of climate justice, that you can't tackle climate change effectively unless you tackle and help and cater for those people who are going to be disproportionately affected by it, which are often the poorer countries and the poorer communities. How important is that in the work you two have to concentrate on climate justice?
So I think climate justice is the thing that keeps me up at night, to say, you know, I'm in a huge privileged position to be, you know, feeling in my safe warm house at the moment. And I think the thing that really got me thinking about it was fuel poverty. The first time I learned about fuel poverty was only a couple of years ago. And I thought, why was this not focused on in my training? If you really look at fuel poverty, so that's people who can't afford to heat their homes. You might have heard the kind of heat or eat, or people talk about, you know, saying they have to make a choice about whether they're going to heat their homes. And there are services available that helps people out of fuel poverty, but I didn't know about them. So I think in my role as a kind of GP, I think we often don't really realise how much we are in advocacy role, and how much those primary care contacts, you know, even the kind of health visitor, you know, all these people who work in the community who have patient contacts, it's often just a signposting thing to say, you know, here's somewhere you can go to get help. And then I guess it's how we really find out from communities. So I work in a really built up inner city area in London. I've got a lot of kind of big council block houses around me. And again, there's this inequality between the majority of those people will not be driving cars, but they're living in a really polluted part of London. So I think with all these things, it's got to just be really at the focus of all of the discussions that we have. And I think the inequalities agenda has become more of a focus. And there's, you know, even in government, there's more and more happening. But particularly we're saying we're putting health in the centre of climate change. I think inequalities has to be in there too, because at a global level, of course, that's happening. But I think the way that you talk to people here in the UK is you say it's happening on your doorstep. And, you know, 60% of our borough in Islington is in polluted air. And those most polluted areas are definitely be where the poorest people are living, and probably the people who are least responsible. So it's a really difficult one to address because it feels so systemic and big. But I think Mums for Lungs is a really good example of a community-based grassroots campaign, which got the school streets up and running, and, you know, meant that people aren't idling, and all these things that they've done from some mums who got together and made decisions. So I think that's what I'm doing from a healthcare point of view, is really trying to get the climate justice sort of focus out there to say that we do have a role to play, to make sure, like Zoe said earlier, that it's in the agendas that we're discussing, and that you try and lift. I think it's a lot about amplifying. You know, I'm not the best person to talk about how it feels being impacted because I'm not in a position of that, but to get those people to be in the conversation. And we do it in other forms of healthcare. You know, I went to a learning disabilities meeting and we had somebody with a learning disability giving part of the talk, and I thought, this is amazing that we're hearing from somebody who's being impacted. So I think we have to find a way to amplify voices better than we are doing already.
And Zoe, I mean, that's certainly what you're trying to do, isn't it? Because with your brief and your interest in inequality, climate justice must be really in the forefront for you.
Yeah, absolutely. And I think that shows up where we're looking at this from. I think sometimes, obviously, as Tamsin's kind of alluded to, with the things that different people focus on, and obviously, you know, adapting buildings and kind of being estates focus is really important. But I think this needs to grow from a communities, residents and inequalities focus. Yeah, and just echoing some of what Tamsin said, we are trying to work to make sure that we're including those voices and those experiences. Just, yeah, absolutely hearing from people at the Enfield network around, you know, where these, you know, those like similar to what Tamsin was saying about Islington, like where those pockets of air pollution are the areas where we know to be kind of the poorer areas and that are going to be impacted, like things like the expansion of the incinerator. So it's just, and how are we kind of linking that up with what we're doing in health and how we can kind of advocate for good health. But yeah, it's definitely where we're kind of focusing this on.
Okay, I mean, two sort of questions at the end. One, Tamsin, I mean, in a group like we've got in Enfield, which is Enfield Climate Action Forum, we've got 120 civil society organisations involved, which is a lot. How do we get GPs involved? How do we involve them in that? I mean, there's been a group called Doctors Against Incinerator, which has been very interesting, protested this weekend. But how do we get them involved? How do we approach them? Because their involvement is vital for this.
Yes, I think when I'm trying to get, I suppose it's when you're trying to do your kind of stakeholders and bring people in, I think it's asking questions first and knowing your audience. So we have in healthcare, you know, I'm part of a number of organisations that are not related to climate, and often you have people coming in from various organisations and they do their generic talk, and you sit there and go, okay, well, how is this relevant to me, and what am I going to add to this? So I think coming with a direct ask is important, and saying, you know, your voice in health and saying how it's going to impact health is really important. And I think collaboration, you know, not going for people who are already working on this stuff and interested already, because I'm at the point where I'm a bit swamped in work now, but at the beginning I was desperate to do something. I didn't know where to go with it. So I think there's lots of people who want to get involved and don't know how to start. So I think being a friendly group to say we'd really appreciate it just to come and have a chat to us about, you know, what COPD is and how it's impacted by air pollution or whatever it is. You know, I think we're from a scientific background, so people often are quite, you know, up for doing things and researching about it and kind of going from that point. I think I've learned from my own experience in doing stuff around sustainability and talking to patients is that often people have biases about people that you can quickly, you know, I often give the story about a single mum with 3 kids, and we have a nappy voucher scheme in Islington. And I thought, I don't really want to say to her about the nappy voucher scheme for reusable nappies, because she's going to go, are you joking? I've got 3 kids and I live in this small flat. And she wanted to hear about it. And I thought, actually, I'm putting my own bias of who wants to get involved in this. So I think it's about asking questions first and coming with an ask of what you want to kind of get people involved, would be my experience of trying to get people on board. But you're always going to face people who don't. So I think don't be downhearted if someone just says, I'm too busy. And being flexible as well is really helpful, because we're really, really struggling at the moment. So I think being flexible is really helpful.
I mean, Zoe, the nappy example is an interesting one, because, I mean, you came to our meeting and you found that lots and lots of people were focused not on nappies, but on the incinerator. And that seemed to be, you know, taking up their emotional time. Now, how do you get people to look at the big picture, to not just get focused on nappies or incinerators or whatever it is? You've got to start there, but how do you get them to see that climate change is a huge, big picture that we have to address and understand? How do we go from the particular to the general?
I've kind of gone back and forth on this question in the role that I've got, because I think that it's where you get the hook in with people, isn't it? Often you do have a specific that is a hook to speak to someone about this with. But then obviously, as you're saying, it's quite hard to then bring it up to the next level. What I've realized is with a lot of this agenda is it takes just having multiple conversations in different environments to kind of help to build that picture with people. That's definitely what we've been doing in North Central London. We've kind of, I want an analogy that's more climate friendly, but we have been on a road show, like taking our plan and our thoughts and listening to people and trying to kind of build that momentum around what this looks like in North Central London and bring it up to that this is everything level rather than just the small parts. But yeah, I think you need a combination of both. But I definitely, like we've been saying in this discussion, it's definitely about that enthusiasm, asking questions, sharing the evidence, talking about people's experiences and making people think about it as the whole of the way that we do things and the way that we live, not just these kind of one-offs.
And I suppose, Tams, and it's the other way round with GPs, it's going from the general to the particular and saying, this is the big problem, but the way in which you behave and you practice your profession will affect people positively.
I think that first question is a really, really interesting one. And I guess my response to both of them really is it's got to happen at all levels. So I think at the beginning I thought I'm going to get the glass milk bottles into the practice and I'm going to get people to like put some posters up, and then it felt so small scale. I was like, what am I doing? This is making no difference. And then I joined the North Central London group and went, right, we've got to have a strategic direction and we're going to do all these things. And I kept getting people back saying, well, you need local champions and you need to do stuff on the ground. And so you have this back and forth all the time. And so I use the kind of top down, bottom up, meet in the middle approach with most people when I speak to and they ask me that question now, because I really think it's got to happen everywhere. And I think in primary care, the biggest thing that I think my personal kind of what I want to do with my work in North Central London is work on prescribing at a top down level, because we are you know, we have formularies, we have incentive schemes, we have things that GPs will look to for their prescribing, and prescribing is the biggest hotspot in primary care by a long way. So that's the kind of top-down thing that I can do. And then I think the bottom up is that you have to bring people with you, and you're not going to bring people with you. I tried by saying, it's really scary, like, look what's going to happen in the future, here's all the things that are going to happen. It doesn't bring people with you. You have to make them believe that those small things matter. And then I think anybody who gets a little bit of an interest, you then read about it, and then you realize quite how big the problem is, and then you want to do more. So I think that I don't underestimate small changes, and I don't underestimate bringing people at a level which is just congratulating them if all they've done is kind of got a compost at home, or, you know, something, because that's the first thing, and you don't know which point the catalyst is going to be for somebody to say, you know, my husband works in policy, or my wife does this, and they've done all these, you know, you just don't know where the kind of not ripple effect of changing someone's mind on something. And I don't think you do that, in my opinion, with fear. I think you do it with hope and encouragement. And so the primary care stuff has to happen at all levels, and what we're doing as part of our North Central London is trying to make it easier, trying to say what are the things that are really difficult to change that we can try and knock on the right doors for, so that we're coming back and feeling supportive of practices and not asking them to do it themselves.
Okay, so I mean, that's really a lesson for us all to realise that the small changes are important to make people engage on the bigger issue, and that's a real salient point. We sort of come to the end of our 30 minutes now, so I'm just going to ask you finally, Tamsin, if anybody wanted to get in touch with you about the networks you're involved in, how would they go about doing it?
Yeah, so Greener Practice has a website. So I didn't start Greener Practice started in Sheffield, and we now have 17 groups across all over sort of Wales, England and Scotland, trying to get in touch with someone on Northern Ireland. And so you can find a local Greener Practice group. So if that's in London, it would be greenerpracticelondon@gmail.com. It comes to me, and I can email back. And then the Centre for Sustainable Healthcare is for healthcare, but if you're interested, they do training courses. Lots of their information is open access. They also have a website. And there's, I'm probably going to forget something now, but there's the Green Impact for Health toolkit is based on the student sort of model, so that again can be used in workplaces and things. So if you get in touch, I can kind of share those things, but most of the stuff that we're talking about is on the Greener Practice website.
Okay, and Zoe, how would they get in touch with you?
Yeah, I'm really keen for people to get in contact, definitely in setting up these kind of collaborative networks in the scrutiny of this plan. So they can email me at zoe.garbett@nhs.net. So my first name, surname.
Okay, all right. Well, thank you both of you for doing the interview, because I think it's been really interesting. I think a lot of people sort of know that climate change is going to impact on health, but they don't understand the complexities or the levels of it. And I think you've explained that really well. And you've talked about how civil society can be involved, how GPs can be involved in their practices with people and civil society. And I think all that's important, and that's been valuable. So I think this webinar has been really, really useful. So thank you both, for joining us and doing it. And we'll end this webinar interview now.